Hey everyone, this is John from Friends with Your Benefits. Look, some of you out there may have seen our recent video on the Hello Heart blood pressure monitor, but I actually learned recently that Hello Heart does more than just that. Joining us today to tell us a little bit more about Hello Heart and this new thing called cholesterol tracking is Jenn Roberts, and Jenn is the VP of Employer Health Strategy. Hey Jenn, how's it going? Welcome to the show.
Hey, Sean, thanks for having me.
So, Jenn, before we get started, I want our viewers to get to know you a little bit more. So, can you tell our viewers a little bit about your background and maybe a fun fact or two?
Sure, I'm an exercise physiologist and clinical researcher by training. I've always worked on cardiovascular disease prevention. So,
Hmm.
coming to Hello Heart has been the perfect fit for me. And fun fact, I live on a small sustainable farm outside of Houston with a gaggle of animals, including chickens, bunnies, horses, dogs, cats. And if you're wondering, these are peacocks behind me because they
No
run.
kidding. How'd you end up on a farm? I mean, how did that happen?
School districts, kids, moving out of the city, that whole thing.
Well, very exciting story, and we'll certainly have to dig into that at another point. So, talk to me about Hello Heart, right? I'm sure you saw my video on the blood pressure monitor, and you and I connected, and you talked about the cholesterol tracking. So, why don't we start there, and maybe you could show our viewers after we talk about it a little bit what it looks like.
We were so thrilled to see the two videos that you did. It was amazing. And we just said we have to connect with him and tell him about all the wonderful things that we do. So essentially, it's a digital therapeutic to improve heart health. So we focus on the
Okay.
whole heart. So that's going to be your blood pressure, medication tracking, digital lifestyle coaching, as well as cholesterol and a regular heartbeat. So it's really helping members manage their heart health on their own. So they may see a doctor or a health coach, but what do they do for the 23 hours and 50 minutes that they're not in with a provider? They have to do the hard work themselves, move more, eat better, reduce stress and risky behaviors like alcohol and smoking. And that's what we do at Hello Heart.
That's a lot of stuff for people to do, and certainly by you guys making it just a little bit easier, I'm sure that goes a long way to helping, right?
Absolutely. And we're somewhere around 1 million strong members, about 90 different customers across the country and continuing to grow.
Cool. And you guys, as of right now, primarily focus on the employer market, right?
Definitely. We're expanding into health plans and other groups and have a lot of partnerships and relationships with other vendors, John, that you probably work with in your practice.
Tell me a little bit more about this cholesterol tracking that's there, right? So I opened up the app recently and it says, hey, do you want to import your results from your lab? And for me, it's Quest. So how does that actually work?
It's interesting because cholesterol is one of the least managed conditions in terms of chronic conditions and such a
Really?
high prevalence. And it really meshes up when you're thinking of heart health. So you're thinking
Hmm.
cholesterol, hypertension, and diabetes. What do you do for cholesterol? There really aren't vendors that are managing it. So
Right.
what we've integrated in our app is, like you said, we gave you a prompt to import your results. They can come from Quest, Labcorp, your health system, your electronic medical records, and it'll download all your historical cholesterol reports,
Hmm.
as well as any reports that come through in the future. Then it takes that, creates a tracking mechanism for you, and really curates this AI digital coaching based on how you can improve your lifestyle to improve your cholesterol.
I think our viewers really want to see what it looks like. So if you don't mind, can you actually show us a little demo of what it looks like on your phone, perhaps?
I can. So I got my little app right there, and I'm going to sign in and get started. All right, let's take a look at the app itself. So you can see that you can easily track your blood pressure over time, and showing it in this graphing format is a lot more intuitive and simple for people to understand compared to a long running list. If something was going on that day and I want to add a note, maybe I ran up the stairs right before I took my blood pressure, I can do that as well. And I'm also tracking in a very same way my cholesterol, see how that is over time. I can also hit any number and say, what does this actually mean? This is really important for cholesterol because high can be good and high can be bad. And normally you just get those black and white printouts and ranges and what does that mean? And maybe the doctor, the nurse, or the MA calls you and says you have a high reading or a low reading here. So this makes it really clear for people to understand and take action. Here's some specific things that they can do and push them into the coaching. You can also share these reports with your provider. So you simply click this share report and you can see it'll dial up for the whole month for you, and you can share via email or e-secure fax. And if it's eSecure Fax, it can go straight into the EMR as it goes through the system. You're also able to track your weight. And if you've got Apple Health or Google Fit, this can come in directly. You can also track your activity the same way or turn on tracking steps with your phone. You can see right here, I need to do a little more activity. So I possibly am going to get some coaching insights about that as well. Important to managing these chronic conditions in your heart health is medication adherence. So we've got a new feature here. You can see that you can add your different medications. You can set reminders for your medications as well. And then you can indicate if you have, in fact, taken your medications and get kind of a gamification streak on how many days in a row can you take your medicines on time. Important, too, is to be able to integrate with the individual's existing electronic medical records and healthcare ecosystem, as well as what the employer is providing. So you can see right here, it's importing from my EMR as well. That's really simple to add. Just click add my medical info. And you're going to go through this human API link and you'll kind of do a single sign on. I've got my provider here, Starfleet Medical. I log in with my username and password once, and then I'm connected. And what's nice about that is as I get new readings, like my cholesterol, another cholesterol test, or different things like that, it's all going to be in there. You can see here's my historical test. I had quite a few COVID tests there, probably not very different from other people as well. And another kind of nice feature, I think, is that when you go to the insights, so these are going to automatically kind of pop up as in-app notifications, and they're really based on your gender, your geography, what your clinical results look like, and how often and how you use the app. So your experience, John, is going to be different than mine. It's going to be different from your aunt in Boca as well. So you really get this curated digital coaching content, and it's all digital, 365, 24/7 on demand. And that's really different from what's out in the market right now, because you've probably placed a lot of clients with groups that do live coaching in person or via Zoom or something like that. That's fantastic. But you still have to do the work as an individual. And this program and this coaching is helping people do the work. So I can go through my coaching tips. I'm getting new ones every day. I can mark them as helpful or not helpful. And then that'll alter kind of the coaching insights, the videos. I never do the meditation videos. I just can't get into it. So I always mark those as not helpful. But every once in a while, I will still get some stress relief ones up there as well. You can see we even taken some tips from users. So here's an example. It goes through our moderator. If it looks good, they'll put it in there. So we'll mark helpful as well. And then this continues to grow day over day. And, the more you like it, the better it gets in terms of understanding you, kind of giving you that Amazon experience. If I go to my About Me tab, this is where everything's rolled up. I can put in my clinician's information, dial directly from here, make an appointment through their appointment line. If I've got a prompt that I need to make an appointment because my blood pressure has been high and out of control, and I indicate I don't have a provider, it's going to look for nearby visits based on my zip codes. I've got a CVS Minute Clinic 2.7 miles away, and I can schedule my visit right through the app, which is fantastic. And I didn't schedule. So it's like, your blood pressure was high, girl. Are you sure you don't want to schedule? And for this purpose, I will say no right now. So this is the app in a nutshell. And we're seeing amazing results, about 2 to 3 times peer-reviewed published clinical results compared to our competitors. Plus, we've got the cholesterol feature, which is first in class to have this and really dive deep into heart health. So this is the app.
So Jen, that was really, really neat, right? I think it's really cool that those results, if I'm understanding it correctly, basically sync up from your local lab and you see those results in real time and you can really use those things to track how your progress is over time and really determine your next health actions. One thing that you touched on a little bit and I found particularly interesting was the medication tracking, right? So personal note right here, I take a potassium supplement because I have a potassium deficit, right? So I know Hello Heart is about heart and cholesterol, but can it actually benefit me?
You can put any medications on there, including vitamins. You get reminders to take them. And you get asked if you actually took them, and it has a whole gamification piece and confetti and complete the circle and become a perfect user. We see about 98% of people who turn on medication tracking actually continue to use that feature over time. So it's really super popular. I wanted to point something out, since you do go to the lab a lot at Quest, it sounds like. When you get those reports, that's really raw data, and you probably understand it, and I do, but your everyday person doesn't quite understand what that means. If I'm 0.1 away, am I really that far away from being out of control or in control? What do those ranges mean? And that's one of the really important things about the cholesterol feature on Hello Heart is it's breaking it down into simple bite-sized information that you can understand at a low literacy and health literacy level. What does LDL mean? What does HDL? How do I influence those? And then the visual tracking over time. So you're actually seeing, like we saw in the demo, how you're having that visualization as opposed to random black and white report that's smeared that you can barely see in your EMR, if you even know it's there, because you probably don't unless you're on top of things like you are, or your doctor something that was really alarming and then reached out to you.
So, Jen, one question for you. I've been hearing this new term in the marketplace called personalized medicine. Candidly, I'm not sure if it actually applies to Hello Heart, but I'd love your take on what that actually is. And why don't you tell our viewers a little bit more about that?
So it's interesting. For so long in my career, we're working on using evidence-based medicine and best practices, be it to
Sure.
manage hypertension, cholesterol. And so here's kind of the standard. If you're over 140, over 90, or if your cholesterol is over 200, start on this med, do these things. And what we're seeing kind of an evolution toward is this really personalized medicine. You're a male, I'm a female. Maybe we have different health habits. Maybe we have different kind of genetic predispositions. So really customizing the delivery of healthcare based on the individual, so it's more impactful. And that's what's so cool about Hello Heart, is really personalized for the individual. And the more, John, you use it, and the more readings and the more thumbs up and thumbs down to the coaching modules that you put in there, the smarter it gets over time. And it really becomes your app and your program that's unique from anyone else's. And that gives you the best chance of making change.
Let's just take this a step further, right? I have an Aunt Linda. Aunt Linda is down in Naples. So I'm in my, hate to say it, late 30s, right? I'm almost 40. So I kind of get these tech things, but Linda's a little bit older than I am. So can she actually take advantage of what you just described?
Well, interestingly, I am not that tech literate, which is ironic considering that I work at an app company. But our oldest sister is actually 101 years old. So it really is very simple and intuitive. I put this program together for my dad, who's 70 and has about 2 apps on his phone. And he
Okay.
was able to sign up, sync, and then continue to use it. So I think that, having been a consultant in the past, there's sort of this misnomer that really it's a younger population that's going to be able to use and harness the power of technology in terms of these programs. But in fact, if you bring down the tech literacy, language literacy, health literacy, we do vision enablement, you really can get at wide bands of the population. And we actually have 54% of our utilizers are male. So John, question for you. How often is it that men like to participate in digital health and wellness programs?
Yeah, probably that number would be extremely low. Probably, I would say certainly under 50%.
Exactly. So this is something that it's really private and it's really personal. And if they want to share the reports with their doctors or health coaches or a loved one, it's completely up to them. We never push that information out. All of the power is within the user to keep that PHI completely safe and protected. Another thing is really kind of in terms of health equity, we have gender differences, right? Women are 2 times more likely to die from a cardiac event than men. So this can give them the black and white evidence that they need to encourage them to go into the provider, and then the data the provider needs to not dismiss their symptoms as anxiety. Same thing with kind of rural and urban populations, in that they may not have great internet access, or the cost for data and minutes is a barrier to care. So our program's all Bluetooth. We're not utilizing any of something that would cost out of pocket for the member, or they could be in the middle of Alaska, or they can be in the middle of New York City and can still use the program.
I did like when I opened the Hello Heart monitor that you guys did provide some complimentary batteries. That was very value add. It's the little things, right, Jen?
It's funny because we do little campaigns throughout the year based on how much you're utilizing the program. And if we see people kind of drop off a little bit,
Yeah,
we'll say, would you like a water bottle for taking your blood pressure today or things like that? And a fresh set of batteries was the number one way. And so 20% of people who got messaging about that actually took a blood pressure within the first week so they could get their fresh batteries. So we'll
I
continue
believe
to
it.
use them. Don't let batteries be a barrier to taking care of your health, Jan.
Fair enough. So, Jen, we definitely covered a lot today, right? So, let's say there's an employer out there, or maybe even an individual who wants to learn more about Hello Heart. Where can they go to learn more, or perhaps reach out to you?
Super easy. You can go to helloheart.com. All the information's on there. Click to email, or you can send me a direct message in LinkedIn. I'm on there as Jenn Roberts, working at Hello Heart, and happy to help you.
Awesome. Well, Jen, thank you so much for coming on the show today. We really appreciate it.
Thank you, John. Thanks for having us.
Absolutely. And for our viewers out there, we want to hear from you guys. Have you recently tried out the Hello Heart blood pressure monitor? And if so, what was the overall experience like? Comment below.